October is Breast Cancer Awareness Month, and local health officials say they've seen many new improvements in genetic testing and how they look for signs of breast cancer. But there's some issues as well. Newswatch 12's Megan Mamlock joins us now live in studio with more. Megan?
Health officials tell me women and men can be at increased risk of breast cancer through obesity, lack of exercise, and menopause. But there's now another threat people need to be concerned about: folks delaying their screening because of COVID-19.
Dr. Wilkie, the director of UW Health's Breast Center, says genetic testing for breast cancer is now far more advanced than it used to be, with doctors being able to test upwards of 70 genes with a simple blood or saliva sample.
For individuals that have a family history of either someone who had breast cancer at a young age or have more than two individuals on the same side of the family, like maternal versus paternal, that would warrant additional evaluation through genetic testing.
There are other genetic risk factors too.
The earlier you start your periods and the later you go through menopause, the higher the risk of breast cancer.
But despite all the new available knowledge, doctors say it won't help if people don't get tested. And because of COVID-19, more people are staying away from their doctor if they can help it.
But it's a modeling group that is estimating that we will see, instead of decreases in breast cancer mortality, increases of about 1%. And across a huge group of people, that's big numbers.
Some signs of breast cancer a person can look for without visiting a doctor include dimpling in the breast, a hard mass, and nipple discharge or bloody nipple discharge.
Dr. Lee Wilkie says that there are other things you can do to limit your risk of breast cancer. They include limiting your alcohol consumption, healthy eating, and exercising. But they say it's important to continue to see your physician for your screenings and be breast aware. Justin?